And we'll give our folks just a second to find their seats. All right, we will call to order our FY2027 budget work session this morning. Thanks for joining us, and I'm going to go ahead and turn the floor over.
Thank you.
Thanks, John.
Good morning. Welcome to our budget work session on first pass budget for fiscal year 2027. This is a look at our budget calendar for fiscal year 27. We met in November for our budget retreat, where we discussed our budget by function and began preliminary discussions of the factors that would be impacting budgeting this year. In January, we spent some time discussing our capital improvement plan and the need for focusing on capital infrastructure and understanding our debt needs. You can hear a little bit of that right outside. And today we'll talk about requested expenditures for fiscal year 2027. We'll return next month for revenues, and again toward the end of the month to tie it all together before delivering a recommend budget with budget message on May 5th. At the following meeting on May 19th, we will hold a public hearing for the budget and move to adoption of the fiscal year 2027 budget on June 2nd. Our agenda is as follows. Jay Shee will begin a discussion of some of the budget drivers, and then we'll talk about our county services in context of this year's budget before we begin discussing budget requests. We'll have some discussion around personnel costs, and then budget analyst Sam Riddle will give us an update on air quality. From there, we will move into vehicles. We have our fleet manager, Jake Plote, with us, and we'll discuss capital requests and then ask for some guidance from the board. Then we'll talk a bit about our next steps and wrap up. I'm going to go ahead and hand over to Jay.
Thanks, John. Morning, commissioners. So to start off with economic conditions and our current economic context, I think we can all agree that we've been through a lot these past couple years. Since 2020, we've lived through several major events or economic disruptions that have broadly impacted the global economy and had significant inflationary impacts. So to recap, obviously this decade began with the COVID pandemic in early 2020, which disrupted global supply chains, and when combined with fiscal stimulus dollars coming in, helped contribute to an inflationary surge. Then we saw the Russia-Ukraine conflict that began in 2022, which again disrupted global supply chains, notably in energy, but also in manufacturing and agriculture, which also contributed to another acceleration of inflation. Next, almost exactly a year ago, we saw the institution of historically high U.S. tariffs on imported goods. So far, the impact of tariffs on inflation has been a bit muted, since businesses have generally been able to either partially or entirely absorb tariff costs rather than passing them on to consumers. However, there is concern that as more businesses are unable to continue absorbing tariff costs, we may begin to see some delayed inflationary impacts in the coming months or years. And most recently, we have the extremely current situation of war in Iran, which has obviously caused significant disruption to oil and gas supply chains, and which we've all seen the immediate impact of at the gas pump. How the situation evolves in the coming weeks and months remains to be seen, but if the disruption to supply chains is sustained, it will likely result in more acceleration in inflation moving forward. So looking ahead, I also want to just say what's left unsaid on the slide is also any potential impactful geopolitical event or events that could occur in the future that we don't know about yet. Of course, like a month ago, we had no idea about the current situation that was going to happen in Iran. So a potential event that could occur in the future, which if recent history is our guide, seems to be happening as an increasingly regular occurrence. And then adding to the general economic uncertainty that we are living through is also just budget uncertainty at the federal and state level. At the federal level, we have the partial government shutdown that has now stretched to over a month and counting, which has shuttered the Department of Homeland Security, which notably includes the Federal Emergency Management Agency, or FEMA. At the state level, a new state budget remains unpassed, which leaves us the only state in the country that still lacks a new state budget. Being a local government, the county is particularly sensitive to any disruption or changes in funding from the federal or state level, and having such significant uncertainty on both the federal and state level is particularly challenging for us as well as our education partners. So next, just to further illustrate the inflation picture that has developed over the last several years, the chart on the slide details a rolling 5-year compounded inflation rate over the last 40 years. Currently, as of end of 2025, with the accumulated impact of the economic shocks I just talked about over the past couple years, we are seeing the highest 5-year inflation rate since 1991, 34 years ago. Just as an aside, though I was only about 1 or 2 years old at the time, so I don't claim to be an expert on what happened, but having done a little bit of research, that period was the culmination of several years of elevated inflation in the latter part of the 80s, and then a recession in 1990 caused by spiking oil prices due to another conflict in the Gulf region, which was the Iraqi invasion of Kuwait. And that gradually subsided with the success of the U.S. intervention in liberating Kuwait. So that's kind of a little backstory about the last period of that we've seen these kind of elevated inflation levels. So I'm going to hand it off to John now to discuss.
Before we go on, can you just provide some more context? Because when folks just see this graph, it looks like we're showing each year, but you're talking about the 5-year rolling. So can you just clarify more, like why you're showing a 5-year rolling and why you think that's important to note versus like a year-by-year inflation?
Yeah, I think the 5-year what we're trying to show here is kind of the accumulated kind of impacts that we've seen over the past 5 years. What this shows is, so a 5-year rate, so taking kind of 2021, what the inflation level was there, to 2025, how much that's grown as a percentage, and then just going kind of rolling that back every year. I think, the reason why we went with the 5-year is looking at the annual is great. It gives you a good picture of like what's happening on a year-to-year basis, but what we've really dealt with in the past 5 years, I think, is pretty historic. So that's kind of what we wanted to illustrate.
And so basically you're saying like the 24.4% is the increase inflation over the past 5 years?
Yes.
Yeah.
And that rate, 5-year rate, is unmatched since the period ending 1991. So this 5-year rate from 2021 to 2025 of 24.4% inflation is unmatched since that period ending 1991. So if it feels like you've spent more at the grocery store and are spending more doing things, it's true. Inflation has driven the costs of not only for consumers, but the county as well, to include the costs of personnel, healthcare, contracted services, construction, and supplies. Additionally, this community has an expectation to return to normal over a year and a half after Helene. We've brought you discussion on our capital infrastructure and demonstrated needed investment there. Meanwhile, the state has been having discussions on property tax reform, which they believe is a burden on taxpayers. A reminder that property tax is our largest revenue source and one that is unrestricted as well, and that new laws guiding the county's taxing authority could impact our ability to continue providing basic county services at the level that we do. there any questions about our current environment or anything Jay's brought to the table?
So, well, when you're talking about the state property tax reform, also the reality is there's things that we're mandated to do, right, from federal and state
Yes.
level, and the reality is that they've both been reducing how much money they give us to actually fund those things, but they're not changing the fact that we're mandated to provide those services.
That is correct. Thank you, Jack. So we're going to begin with a discussion of our county services by function. Reviewing our current year, fiscal year 2026 general fund budget, we have a budget of $438.1 million. We budget by function, the largest being education, at $125.9 million, 29% of the budget. Public safety is next at 23%, or $98.5 million, followed by human services at 22%, or $96.8 million. General government comprises 15%, or $66.5 million. Our debt payments are $18.3 million, 4% of the general fund. Cultural and recreational is 3% at $12.2 million. Economic and physical development is $10.8 million, another 2%, and interfund transfers come in at $9.1 million, or 2%. We're going to talk about the services each of these functions provides. The education function funds local current expense, mainly operating expenses for the two K-12 school systems and operating for AB Tech. There are several education-related contracts budgeted in this function. Additionally, Health and Human Services contracts for school nursing. They also provide school social work support to Buncombe County Schools at a cost of about $3.7 million, while the Sheriff's Office provides school resource officers to BCS at a net cost of around $2 million for salaries and day-to-day supplies. Questions about education? Moving to the public safety function, the Sheriff's Office represents 53% of the budget in this function. The Sheriff is, by statute, elected to provide countywide law enforcement, operate the detention center, execute warrants, and provide courtroom security, and is funded at the discretion of the Board of Commissioners. The Sheriff is also allowed to provide school resource officers. Additionally, the Sheriff operates a real-time intelligence center and provides animal control services. The next component of public safety is emergency services, which provides ambulance service, community paramedicine, runs emergency management and disaster response, operates the Office of the Fire Marshal, and manages our regional public safety training center. Furthermore, our public safety communications, or 911 operations, are the answering point for emergency calls and dispatch of public safety services. Justice Services provides a wide array of services to include operation of the Family Justice Center, diversion programs, reentry and pretrial services, treatment courts, and community partnerships. Our ID Bureau provides fingerprinting services, issues concealed handgun permits, and maintains the local master name index for public safety information systems, while our public safety interoperability partnership is run by our IT department to maintain IT support for local public safety entities. Both departments receive offsetting revenue from other local public safety entities. As we move to human services, which comprises our Health and Human Services department, we look at the social services side, which provides public assistance for eligible households, food and nutrition services to include SNAP benefits, Medicaid for older adults, low-income families, and other vulnerable populations. Social work provides services for the aging population, as well as child and family social work, and resources for foster and adoptive families. For the remainder of Health and Human Services, Public Health provides preventative health services, vaccines and immunizations, and treats and plans for communicable diseases. They also provide environmental health inspections for our food and lodging establishments and septic and well systems. Animal Services contracts for animal care and operations of the animal shelter. Furthermore, there are veteran services and behavioral health support budgeted here and also provided by HHS. Our general government function comprises 19 departments. Here you see the first 8 of those departments. This is inclusive of county management, budget and finance, which provide fiscal, budgetary, and debt management services. Election services are included here. Our general services department provides building, grounds, and fleet maintenance, as well as conducts implementation and management of capital projects. Also included in their portfolio are administration of county parking lots and decks. Human Resources provides personnel management, while Community and Public Engagement conducts countywide communications and facilitates community markets. Also included is governing body, which includes the clerk and the board's budget. In the second half of our general government function, you see information technology that provides countywide IT support. Strategic partnerships facilitates community investments and grant management. Our legal and risk department provides legal support and risk management. The Register of Deeds, led by an elected official, is responsible for recording deeds and indexing vital records like birth, marriage, and death certificates. Tax assessment conducts property assessments, and tax collections collects property taxes and occupancy taxes. Also included here are the internal audit function, sustainability, access and human affairs, and our newly established Helene Recovery Office. Our cultural and recreational function is comprised of libraries and parks and recreation. Libraries operates 12 branch libraries as well as the Buncombe County Law Library per statute and provides virtual library services as well. They also offer learning programs and events for a wide spectrum of county residents. Parks and Recreation operates and maintains 8 parks, 7 river parks, and 5 pools, as well as delivers recreational programming and events. Our economic and physical development function includes the planning department, providing land use planning, zoning, stormwater, erosion control services, and administration of the affordable housing program. Permits and inspections administers and enforces state building code and leads the nuisance and abatement team. Agricultural and land resources supports farmland preservation, soil and water conservation, environmental education, and other programming. And economic development explores incentives to create jobs and bring employers into the area. Also included is our solid waste enterprise fund. Remember that the enterprise fund is not funded by the general fund revenues and is self-supporting. Currently, they have an $18.4 million budget, which operates the landfill and transfer station, manages the collection contract, with implementation of diversion services to include recycling and compost programs. Are there any questions about services provided across the organization? I'll pause here. Okay. We're now going to talk through requests for fiscal year 2027. Reminder that this is still the first pass budget, and some requests here may not be included in a recommended budget in May. Moving through our functions again, this time in terms of the requests, we begin with education. As you remember, we worked on a local funding agreement with our K-12 school systems, which involves staff research across the state, and then came to an agreement on funding between the board and both boards of education that focus on our major unrestricted revenues to include property tax and sales tax. This agreement focuses solely on operating needs and takes 37.76% of the 12 months of property tax and local sales tax prior to March. This was arrived at via the school's request by being 2% above the last fiscal year appropriation, which was the growth rate at the time for these revenues.
I have a question then.
Yes, sir.
On this 37.76, now that won't be the percentage on the final budget, will it?
That's the percentage of these revenues. We agreed.
Right, but it won't be, when we look at the total budget, they won't get 37.76%. Good, yeah.
This is 37.76% of these revenue
Right,
streams.
okay.
Going back 12 months from
Yeah.
March. So this is a 5-year look back at the local current expense funding for the K-12 schools. You see this year we provided $117.3 million, which includes $4 million from Article 39 sales tax that would have otherwise gone to school capital per state statute. That use was allowable for 2 years, but there is no current plan to use that funding this year. The new funding agreement will actually increase the local current expense funding by $11.1 million in fiscal year 2027, bringing it to $128.3 million for both school systems to be split along the ADM percentage. We will have AB Tech here at our next work session for their budget request.
And John, you did say the 117 included the 4 million.
Yes, it
Okay.
did. And our math was based on, for this year, for the funding formula to push the $117.3 million up 2%.
Okay, thank you.
Moving on to public safety, this is the area that has the most requests in the fiscal year 2027 first pass budget, with additional requests totaling $18 million and 9 new position requests. The Sheriff's Office has requested 60% of these requests at about $11 million of additional budget requested in fiscal year 2027. We'll speak more to those specific requests in a moment. Additionally, support departments across the organization assist the sheriff with $12.6 million of funding in other departments. Almost 25% of our information technology budget, around $3.1 million, can be attributed to sheriff support, to include body and dash cams, which are increasing over $200,000 in costs this year, radios, software, and licensing, and other technology. We are budgeting $3 million in vehicles for the Sheriff's Office through fleet. General Services provides utility support and building maintenance, as well as staff for maintenance of the detention center. And there are $5.8 million in capital projects specific to the Sheriff's Office and the detention center, which we will discuss when we move to the capital portion of our program.
And this is all in addition to the basically 11 million that's in the request above.
Yes.
Okay, this is helpful to have this broken out and show the other expenses across departments, so thanks for doing that.
Moving to the specific requests for the Sheriff's Office, there are 2 position requests, including the first pass. An accreditation officer, which is currently grant funded and would move to the general fund, and a property and evidence manager position, including the operating request is year 1 of a 2-year cycle firearms replacement at $330,000. A new detention call monitoring software, which would be an additional annual cost of $210,000. One-time ballistic vest upgrades of $70,000. Canine replacements of $39,000. Additional costs to the jail health contract of $1 million, as well as $300,000 more for jail food and supplies. There's also a request for drones, which would be $132,000 annual cost. These operating requests are roughly $2.1 million in additional costs in fiscal year 2027. Are there questions about the sheriff's requests or support of the sheriff's office?
I have a question. You said this was around 2.1 million that you just,
Yes.
so we've got 5.6 million requested attention and 5.7 million.
That's also is inclusive of personnel costs.
Which is only 2 personnel.
Well, and
Right.
we're going to talk about additional personnel personnel costs with health insurance as well as some other factors in a few minutes.
Okay,
But this is the inclusive overall expansion of,
okay. But yeah, that's just such a big, this is around 11 million. What you just spoke to is 2 million, and then there's 2 personnel. So
These were the large individual requests. There's small requests throughout, like for travel, for training. There's other small requests, but these are the large ticket items that we were lifting up for y'all to see.
okay. Yeah, I'm just trying to figure out the difference between that 11 million and the 2 million.
There are other small requests, including though, to John's point, there's salary costs for existing employees. That is not part of these operating expenses. So salaries we will talk about differently when we get to the personnel section. But we wanted to lift up the individual items that were large dollars. And these are just the large dollar items. Other than that, there's small increases almost in every other line item.
Okay.
many inflationary costs that we're seeing as well.
Can you speak a little bit to the $1 million increase in the jail health contract?
So the jail health contract is almost half of the entire operating of the Sheriff and Detention Center. So this went out for bid this year. So we did our request for proposals and went out for bid, and they are currently looking at the proposals that came back. So a large portion, there are fixed costs about the jail health, for jail health, but there's also outside medical. So if there's treatment provided at another provider, usually the hospital, then we're billed for those services as well. So it's a little harder to ascertain what those costs might look like, and they're an add-on to the contract. So we're expecting about $1 million increase to the current jail health costs. It may not be that much once we get through the contracting, but at this point, this is sort of the number we're looking at.
Kind of a placeholder right now until we know for sure. I just want to make sure I heard you correctly, that approximately half of the detention center budget is jail health costs. So if we're looking at our
Of the
26
operating dollars.
of the
yes.
operating, okay. So what does that number, you can come
About
back.
6 million.
Okay, thank you. I just wanted to make sure I comprehended that correctly.
3 years ago, it was less than $3 million. And so we're telling you right now, it's closer to 4 to 5 million has been the increase in jail
So
health.
it's been going up every year.
And John is thinking it might be less than $1 million. I don't think we're gonna see much reduction in that because of that outside medical care that we can't predict.
Right.
So if someone needs to leave, the nurses that are on staff has to go out to the usually Mission Hospital, we get a bill for that.
Okay,
And that is not predicted because we don't know how many people are gonna have to be transported.
that makes sense. Are there other questions about public safety?
But I wanted to make sure John said to you that we do bid this contract out. It is right now in the process of doing that. So it's not something that we sit back and take that increase, but we do believe that it will see that $1 million increase in cost this year.
Even with a new, potentially new provider.
Yes.
As we move to emergency services, they have 5 position requests. They're requesting an additional assistant fire marshal, an emergency medical services training officer to train paramedics, an emergency services specialist for additional disaster preparedness, as well as 2 community paramedics currently funded by ARPA funding expiring at the end of the calendar year. Additional emergency services operating include moving to leasing for cardiac monitors, which is $350,000. There are new lease agreements with fire departments to house ambulances for about $216,000. Emergency services is taking on countywide security, and cameras and contracted security adds roughly $890,000 to the budget this year. Other non-capital equipment is $103,000, and then $240,000 more in medical supplies. For 911 operations, we see an $89,000 increase for their responder support services, which is on-site mental health and counseling for 911 telecommunicators.
Couple of questions, John.
Yes.
On the countywide security budget items, can you just speak more to that one?
So this is contracted security at locations across the county. This includes the tax office, HHS. We're looking at security for this building and the PAC library. So that's contracted security to be present at those areas. Also looking at more cameras added across areas where there might not be that's sort of access currently. So we're working through this budget right now to understand what it is that we need to do. This potentially could be phased. So where possible, we'll.
So when it says countywide, specifically county properties is what you're talking about?
Yes.
Thank you for that clarification. So this would be on county properties, and you may recall that we did have at HHS, so if you went to visit that facility, you would have seen some sheriff deputies working. You will see that here as well, and you no longer see that. So with the staffing levels that we have in our sheriff deputies, we are looking to see what other security measures we can put in place, especially at our human services building at 40 Cox and also at PAC Library. You would also, when we go through the budget, you'll see other requests around security, and this is county building security.
Okay, that's helpful, thank you. And then on the
Before we
community.
move on, I'm sorry,
go
Commissioner
ahead.
Wells, but on that same topic, is it commonplace for county governments to contract security, or is this normally something that is provided in partnership with the sheriff's office? I don't know.
Yeah. I think it's a mixed bag. If we can do some more research across other counties, but some counties we came across one that have a county police department that provides that security for them. It is under the umbrella of the sheriff, but their county staff that does that. Other counties have security, but for us, we used to contract with the sheriff, so there was a contract in place where we hired sheriff's deputies to provide that security, so it was a kind of a contract. But with staffing levels and the need for more SROs across our county, that is not something that they can support. So we're looking for alternatives.
Thanks for that background explanation. That's helpful.
Okay.
Sorry to cut you off, Terry.
No, that's fine. That's good information. Can we get an update on the community paramedics as well, just at some time not right now,
Sure.
of course, but
Yes.
just to have an update on that, how it's going, kind of where the needs are.
Yes.
That would be helpful.
In our remaining public safety departments, the Identification Bureau is requesting 2 additional senior identification technicians and a $30,000 increase for a new fingerprint reader, while PSIP sees about $62,000 in increases to existing contracts to maintain our public safety communications infrastructure. Are there questions about public safety requests? Health and Human Services has increases of $6.1 million in the function, with 5 position requests across that department. For position requests, Health and Human Services has requested a social worker to provide independent living case management and support for foster children, a social worker for adult services, 2 environmental health specialists who conduct food and lodging inspections, and funding of a public health nurse for the mobile team, which was previously funded by grant funding. For operating, we're looking at a security system that will require $50,000 annual software maintenance, $173,000 in additional storage and records management contracting. The animal shelter contractor is requesting a 13% or $221,000 increase for services. Special assistance in-home services mandated by the state will result in $311,000 in additional cost. Staffing for the energy program through contract will cost $130,000. Social work visitation adds $66,000. Additionally, there's a request for $82,000 for emergency placements in foster care, no longer funded by the state. Additional $49,000 for the guardianship contract, a $50,000 increase for supplemental aging services to restore funding cut last year, and a $100,000 increase to the school nursing contract. Are there questions about Health and Human Services requests?
Yeah, how does this track? This makes sense, but I guess I don't have a context for understanding how this tracks with our county's growth. Are we going to be having even more next year? Help me just contextualize what this means, because I would hate for us to have one
Do you mean,
request.
are these new annual costs in perpetuity? Is that?
Not just in perpetuity, but like, for example, we know that certain departments have had more needs, Health and Human Services, huge need over the past year and a half for a lot of reasons. Is this sufficient to get us through projected growth for our county, or is this just kind of a stopgap we're filling in, waiting for help to arrive?
It's a variety of things. So some of these things I would say specific to social work are less revenue received from the state to support these items, so we're having to make up the gap with local funding. The energy program is largely seasonal, so that's staffing that's needed. We brought that back in-house about a year and a half ago, so we're still exploring how we best manage those costs internally. The special assistance in-home, a lot of dollars have been shifted to the counties across the state for this program, and with an aging population, this is a service that we do get a lot of use out of. The adult guardianship is a renegotiation of that contract rate. Those are our adult wards that we have in care. We have maybe between 100 and 200 wards in care. So this is a case management guardianship contract. We do a renegotiation of that rate every few years. School nursing is largely around the contractor saying they need to be able to pay a little more to recruit school nurses versus other nursing professions. Does that answer some of the questions you have, Commissioner?
Yeah, and I'm not intending to put you on the spot. I guess I'm just saying, realistically, if we go into the community and people are saying we're not having our needs met as far as adult services, I'm just going to make one up. I've not had this conversation, but if they said we needed more money for adult services, would that shock you, or is this the appropriate ask, or is this a conservative ask? I'm just trying to gauge where we're at in our budgeting right now.
I would say it's the conservative ask. The department asked for way more employees than is presented here. In your packet, you will see the list that they're asked. We had almost 180-something positions. 136 positions requested across the organization. This is a small piece of what that request was. So if your ask is, do they think they need more people? They would answer yes.
Okay. Thank you.
I'm not questioning the emergency placement position and the need for it, but I am questioning, is that an example of the state not funding something and pushing that to the county level to have to pick up?
So what happens is some of the funding comes and goes, and the state, similar to other entities, had ARPA funding. And sometimes they funded things that were programmatic in nature with one-time funding, and then they no longer have that funding. So the emergency placement foster care was a 2 or 3 year funding source from the state, which we do have a need for emergency placements for foster care. However, the state no longer is providing that funding because they no longer have that revenue stream. So in order for us to continue this level of services we've become accustomed to over those 3 years, that's what HHS is saying it will cost to do.
Okay, thank you for that further explanation. The grant funding expiring makes perfect sense.
Yes, and so we did see, and some of that you saw in budget amendments over the course of this last several years, where we brought, here's some new ARPA funding to do this item or do this item. So we did see one-time revenues put out for programmatic needs, and if we want to continue those programs, then it's now our cost.
It's incumbent on us to do. Okay,
I
thank
do
you, John.
have a question. The special assistance, adult care, and in-home, are there gonna be more slots or more homes opening? Because special assistance, adult care is linked to the bed availability of the community. In-home has to do with like the TCLI program. So could you explain like why the increase? Like, are we expecting to have more beds? Are we expecting more staff needed?
I do know that our cost share has increased. So,
So not new beds, but increasing in our cost share, and we can get you a more detailed answer on that. But is this the one that was a contract and we're bringing in-house?
no, this is special, no, this one is,
Okay.
Is our
This is
cost
just-
share increase because of the state pushing those costs?
Yes.
Share increase on us, so this is another one that the state is,
Yes.
okay, we're mandated to do this, but they're reducing the amount that they're giving us, so it's increasing our cost.
yes.
Okay.
It might be helpful, not, obviously not for today, but to have a better picture as, at some point, to see what is the state no longer funding or that the cost share has increased, so we can get a picture of what we're being expected to take on due to whatever is happening at the state level.
And we will have more discussion about that next time when we talk about revenues.
Okay, thank you.
So there will be shifting in revenues that we'll talk about next time.
Okay, well, thank you.
And with that, whenever we get that, can we also get the picture of what's required from VIA as well? Because it's like a three-way, especially for the special assistance in-home, so there's a better understanding, the big picture.
So one more question on this one. We had lots of questions here on this human services.
That's why we're here.
This is good. When we had our association district meetings a few weeks ago, it was brought up about there's going to be an increase likely in what counties are expected to pay toward, I think it was towards SNAP administration specifically. And I think they were saying around 2 million additional for Buncombe County, or 2.3 million. And is that included?
That's not included, well, that's not included here because we've always paid the expenditure.
Okay,
So we've always paid the expenditure, we just receive more revenue.
so it's going to show. on the
So when
revenue.
we come back and talk about revenues, we'll talk about that, because while it's for Health and Human Services, it's often about the county cost. So we may receive, it may look the same amount that we're spending on the expenditure side, but if we reduce revenues, then our county cost has increased.
Okay,
And we will discuss that in some detail next time.
okay, that's helpful, thank you.
I have another question. The adult guardianship, are we seeing an increase in the need of guardians within the county?
So this is our case management contract. So we case management with, we work with one provider to manage the adult wards that the county,
Or are they increasing the cost per person, what we're
yes,
giving?
it was a negotiated rate increase.
So that's already been done? So that's,
That's the request.
okay, gotcha.
But it does include an increase in the number of wards that they're seeing added on each month, and it includes an increase in contracted services costs.
Are there other questions? I think our guests outside may have some questions for us. I think we can keep going.
I'm going to move on general government. Across the excuse me, across the entire general government function, we see increases of about $8.2 million with 13 position requests. These department requests largely support the front-facing activities of the organization. Looking at the budget office, CAPE, and finance, we see 4 position requests here. The budget office is requesting an additional budget analyst or manager. CAPE is requesting an administrative assistant as well as a language access coordinator. And the finance department is requesting an additional financial analyst. Amongst operating requests, CAPE is requesting an additional $30,000 for engagement market expansion. Here you see general services and fleet and our election services. Among position requests from general services, they are asking for technical positions to include an electrical specialist and HVAC specialist. They're also asking for an additional maintenance technician, as well as a senior project manager to increase capacity of capital project management. The increased operating here includes an additional $226,000 for increased election staffing needs for elections, a $211,000 increase in the janitorial contract, $154,000 for building and grounds maintenance. New vehicle leases totaling an additional $42,000 and $23,000 in fleet auto maintenance. You see a decrease here for fleet, but this is due to vehicle purchases now being done in the capital fund. Moving to the second half of our general government function. IT has about $3.2 million in additional requests, making up 40% of the increases in this function. Infrastructure refresh, which is largely switches and servers and such, has an additional $104,000 increase. Technology refresh, laptops, radios, and other equipment results in an additional $266,000. IT licensing and software costs are increasing $318,000 this year. $190,000 is related to the new positions we are discussing today. There are departmental requests totaling $924,000 in new information technology requests. An upgrade of the aging telephone system is expected to be an additional $498,000. IT costs are centralized. Here you see how IT's operating budget also spreads across the functional level, where you see the largest area being public safety at $5.9 million. This is inclusive of the number included with the sheriff earlier. You see $3.7 million for general government, $2.6 million for human services, and about $1.2 million remaining for cultural and recreational and economic and physical development functions. Closing up our general government function, Strategic Partnerships is requesting a grants manager, as well as making a request for the restoration of county administered grants for an additional $1 million. Strategy and Innovation is requesting an additional management analyst, and also $25,000 to conduct the biennial community survey. The Tax Assessment Office is requesting an administrative support associate, as well as a reappraisal data analyst to prepare for the next reappraisal in 2029. And Tax Collections is asking for additional revenue collector. Are there any questions on general government?
On the strategy and innovation position, would that by chance happen to be able to help with the preparedness action plan when we had, I think it was during our briefing, last briefing, when you all were presenting and you were talking about the need to have some dedicated staff to help with that. I'm just curious, is that?
This is more about dashboarding and the need for presenting data in a consumable way to the county and to
I'm
folks.
sorry, I couldn't hear you, John.
It's more about.
I'll jump in. This is about a data analyst. Almost everything we do, we're asking them to data, and they have one person that pulls all that data for us right now. So we have one person in public safety, Dr. Lee Creighton, that pulls all that data for public safety. But when we're looking at our data, this is more about a data analytic person. When we get to emergency services, we're adding one person that can help with that preparedness information as well in the emergency services department. So this can help with that, but the subject matter expert will be living in that department.
Okay, so you did request a position that will be able to help.
Yes, ma'am.
Okay.
Yes, when we're going back to the public safety request for emergency services, one of their emergency management specialists was for that purpose.
Okay, yes, ma'am. Okay, that's helpful, thank you.
Any other questions on general government? In our cultural and recreational function, you see increase of about $1.3 million with 4 position requests. Libraries is requesting a second library safety associate, as well as a library social worker, which they expect to offset by releasing a contract. They are also asking for hours increases for 5 library assistants at several branches. They have additional operating requests of increases of $73,000 to increase the size of the collection, branch furniture replacements, and professional development. You may have heard that we bought a mountain. Parks and Recreation is asking for 2 positions, a landscape supervisor and program supervisor, in order to begin work to establish a park at the newly purchased Deaver View Mountain. Questions about cultural and recreational requests?
Before we move on, John mentioned the 2 positions for Deaver View Mountain. This is the first stab because they will need more people at Deaver View. So this is the 2027 request, but in 2028, you'll see more people that, as this is the design and the start of the park, but to actually manage that park over time, there'll be more requests coming forward for that mountain. So I wanted to, going back to Martin's question, as far as this all we would need, the answer for that specific one is no. There'd be additional requests as we build out Deaver View Mountain as a county park.
And maybe you said it, John, and I just missed it, on the library social worker?
Yes.
That can, because that's not a typical category that
It
we
is
see
not
on there for
typical.
libraries, so.
But
We
were
currently
seeing-
contract with Homeward Bound to provide some level of interaction between populations there, and library feels that it would be more hands-on to have staff and not have the contract.
And is this at the main branch?
Yes, ma'am.
Yes.
IPAC, okay. All right, thank you.
And can you remind me, are we having trouble filling a good number of positions?
Are we having trouble filling positions in general?
Library?
I don't know.
Are there any vacancies that I'm just asking? It's been a
I
while.
don't know about any vacancies today. I don't know that we're having a lot of trouble filling library positions in general.
Great.
We probably do have a couple of vacancies across the organization, but the safety associate goes back to the conversation we were having a moment ago about security. And if you've been to PAC, you understand that the population is changing, but we still have lots of school kids coming into PAC, and we want to make sure that we keep our patrons safe and provide the help that we need as well to the population that we're seeing more frequent at PAC.
Thank you.
In our economic and physical development function, we see 6 position requests. 4 of those position requests come from permits and inspections. They are asking for a division manager for their new code enforcement team and 3 code enforcement officers.
Before we move on, I always struggle when we say code enforcement officers. That's just the technical name of inspectors. So that is not the nuisance abatement team. These are actual 3 building inspector positions. The code enforcement team, though, is that team that we've pulled together across the organization to help respond to nuisance issues. So I just want to make sure the word code enforcement is used there, but it's a different. The officials are actual inspectors. And then the code enforcement team is that team that is multidisciplinary, that we've pulled together to help address some of the issues that we're hearing from our residents.
That's helpful, thank you, because when I looked at it, I did make the other assumption. So those are inspectors, but the division manager for the code enforcement team is
the team that we talk about that would get the nuisance complaints that we have.
Right.
This is that person that can lead all the different departments coming together and ensuring that we have someone that can monitor and address those needs.
Okay, good. So this is the person that would be that team lead
Yes,
on
ma'am.
that pulling it together and be that main point of contact.
Correct.
Okay, thank you.
Planning is requesting an assistant director, and agricultural and land resources is asking for a stewardship coordinator for maintenance and enforcement of our conservation easements. Operating expansion requests include operational costs for the code enforcement team and about $163,000 to include demolition for condemned structures and mobile home removal. Planning looks to accelerate their text amendment program through contracting at roughly $200,000. and requests expansion of the Code Purple sheltering program at about $250,000.
And I want to add that the Code Purple expansion is a placeholder right now because that funding is split between the city. It's a 50-50 between city and county. So we will match whatever that the city actually puts in. But for us, what we've seen this year with the number of cold nights and cold days, we do believe that Code Purple needs an expansion, but the 250 cart is just a placeholder. We don't know yet what that final number is going to be.
Were you finished, John? Are you ready for questions?
Yeah, I was going to ask if you had
Okay.
questions on this section.
I do have a question on the cooperative extension. I would love to get more information on that. I mentioned at our last meeting that when I was in Raleigh, that was brought up by Dr. Fox around the cooperative extension, and I know we have a cost share. I think we actually completely pay for a couple of our positions.
We do.
And I know that from what he was saying at the state and federal level, that has been flat for the past 10 years. And so I'm not clear, like when we did our salary analysis a few years ago, right, where we brought our staff, up, did that also do that for cooperative extension, or did they get left out of that because they're technically state employees?
They are state employees. We pay the state through a contract.
Okay.
So the cooperative extension are not our employees. So we pay the contract based on what the state requests out of our cost share.
So to answer your question a little bit more at home, they're not included because to John's point, they're not considered county employees.
Okay.
They're contracted employees through the state. So their salaries would not have been adjusted based on that. Nor do I recommend paying a supplemental like we do for school teachers, where we will pay a supplemental. That's an option that the board can decide. If you wanted to give them more money, it would be a supplemental pay above and beyond what the state would pay. And we have not included that. We have relied strictly on what the state salary is, and we have not looked to bring them into a supplemental pay structure or any other increase based on what the state pays.
Okay.
But
So
I
the
think what
ones
he-
that we pay are the ones that we are fully paying, are they still state employees?
Yes.
And we're contracting their
Yes.
state salary, but we're paying the full amount versus a partial amount that
They're
we
all,
do.
they're no county employees, they're
No.
all state employees.
They receive state benefits. So they're employees of the state. We're just, through our contract, subsidizing the cost for the state of those employees.
So what you were hearing is that the state has not given them a raise or a budget actually in several years now. So, correct.
And so I'm just curious, like with other counties, can you at least take a look at other counties and see with some of the other counties
Absolutely.
that are in our same
Absolutely.
position, like larger and have those needs, like, are we in line with what they're doing? Or look at some options there, just so we at least understand.
Sure.
I'm not in my head because staff is writing.
Okay,
So, yes.
all right, thank you.
Anything else on this function?
Commissioner, I was expecting you to ask about the stewardship coordinator. And you didn't.
Well, because I know, because they talked about it in the Ag Advisory Board meeting.
I'll take the bait. Do you want to talk about the stewardship coordinator?
No, this is all the conservation easements, and John can probably talk and I'll be quiet on this one, but.
And if I need to, I'll jump in.
There you go. So this is us looking to make sure that we can monitor those conservation easement that we have been working on to get to that 20% of conserved properties in our county. We need to have someone that can actually monitor, make sure that easements are being followed, that we're not falling behind on what we said we will do, and there's in perpetuity and all the things that are the restrictions on that property. So this person will help to do some of that work.
We have been contracting for some of this work, so we would release the
Bring that contract
contract
in-house.
and bring it in-house. They say some of the compliance is related to when this land changes hands over time, it's inherited. Sometimes folks who inherit land don't realize the restrictions or the nature of the easements, so.
And I can speak to it. So used to, we had, well, we didn't have as many easements either, but our staff went out, and I do think it's very beneficial when our staff has the relationships with the landowners. But at a certain point, we started contracting out that work. And so you see challenges there because they don't know the staff and they're not being as proactive in having those relationships. And apparently that contract has grown. At one time, that was saving us money, but at this point, that's costing us money. So it's going to be financially beneficial to actually bring it in-house and have that one stewardship coordinator. So it'll be financially beneficial, as well as the fact that then we can be more proactive and have those relationships. And as that land changes, whether they sell it to someone or someone inherits it, making sure that they have a full understanding of the expectations so that it's a positive rather than having to be kind of coming in later and saying, oh no, you should not have done that. Making sure that folks understand on the front end. You're welcome.
Interfund transfer requests include replenishing funding of our community investments as requested by commissioners earlier this year. There's a $2.3 million allocation to affordable housing where we did not contribute last year. This budget request restores conservation easements to the prior annual allocation of $750,000 from $250,000, adding $500,000. Early child education has a 2% escalator, which would add $80,000 to that transfer. There's a match for the Enco Recreation Destination TDA grant, which we still need to contribute $3.1 million. We've slated roughly 1/3 of that for a transfer. We'll talk a little bit about capital in a few minutes, but we have $1.8 million of PAYGO capital that would require a transfer. The reappraisal is now on an accelerated cycle, happening in 3 years as opposed to 4 years, which in order to fund that reappraisal, we would increase the annual contribution to the reappraisal fund by $848,000. Additionally, costs of...
Thanks, you saw me reaching over. We talked a little bit about the reappraisal fund. You might recall, one of the things that we want to accomplish before the next reval is that full measure enlist. And so that elevated price will help to start setting that money aside to do a full measure enlist, which is where a contractor will look at every improved parcel in Buncombe County. And so you're nodding your head, so, but that's something that we really want to see done before the 2029 reappraisal.
You said that looking at each piece of
Improved
parcel?
property.
Oh, improved property.
parcels, yes.
And remind me what the Inca Recreation match is.
So we have a TDA grant. This is the Anchor Recreation Destination Part 2, which is largely the soccer fields we're installing at the sports park and work being done there. So we requested a grant from the TDA received a grant several years ago for $4 million, which is a 50% match. So we need to match $4 million. So we accepted the grant, but we need to actually contribute $4 million into the budget to be able to match it.
Yeah, I just didn't remember it being here rather than under recreation. So it was throwing me off a little.
Yeah, it's here because it's a transfer because it's included in the grants fund.
Okay,
So
that makes sense.
we move the grant matches to the grants fund via the interfund transfer.
Okay, thank you.
So additionally, we have cost of transportation to maintain the current level of service in that program would require an additional $434,000.
Is that gas cost or is that because of inflation?
It's largely inflationary costs, some revenues falling off, so. These requests reflect an additional $7.1 million in interfund transfer requests for 2027. Do we have any questions about these interfund transfers?
I just hate that that's to maintain the level. I'm just hopeful.
And sometimes what we see with inflationary costs is that people try to hold the line, and then after a few years, now they need it to increase, and they need to increase. So that demonstrates sort of the compounded inflation we're talking about. If a contractor holds the line for 3 years, and all of a sudden their costs have now run up 20-25%, then the ask gets bigger in a single year.
Thank you.
We'll talk about debt in a few minutes in relation to capital projects, but we expect our debt budget to increase by $11.7 million this year. Debt refunding last year brought down our debt payments to $18.3 million, where they would otherwise have been around $20 million. So this includes that existing debt service, as well as an increased debt service for the 2026 bond issuances for adopted county capital and GO bond projects that were brought before you for public hearing last week. Questions? Going to move on to personnel. Per the personnel ordinance, each year the commissioners may grant a salary increase based on a cost of living adjustment, a COLA calculation, to all employees occupying a regular position and grant fund positions for which the funding source allows. During the budget planning process of each year, staff will present a COLA calculation to the board. The calculation is the 2-year average annual change in the Consumer Price Index for urban wage earners and clerical workers, which is the CPIW for short, published by the U.S. Bureau of Labor Statistics, measured as of the December data release, next preceding the date of such presentation. So the board may grant a COLA adjustment through the budget ordinance, and if the board elects to do so, that COLA would be effective July 1st. The calculation is based on the 2-year average change, and the calculation has yielded a 2.71% COLA increase. So in discussing the budget impact of personnel drivers for the general fund, the new position request discussed earlier would total $4.4 million. The state has increased the required retirement match by the county for employees' participation in the state retirement system. And this increase equates to $1.4 million. Healthcare costs are increasing substantially as claims continue to rise, and we will discuss this in detail at our next work session. This adds $5.3 million to the budget. There are roughly $638,000 of additional personnel-related expenses, such as unemployment and workers' compensation. Instituting the annual cost of living adjustment adds $4.8 million of costs to include benefits. As you know, we do not budget 100% of salary to account for lapse, and we will be exploring how much of these costs we can contain by reducing the salary budget for that purpose.
And I know you said that we'll talk about this more at the next one, but I just want to make sure I understood this correctly. So with the health insurance, that's a very large increase.
Yes.
Plus 5 million there. And you said that the majority of that is because of claims?
Our claims have been quite high this year, and our consultant will be here at our next work session, so we can talk about what's driving that.
Okay.
But claims are up across the country. I mean, that's happening right now. Okay. Also, our Medicaid claims have also been quite high.
Okay, so this isn't something just for Buncombe County with these claims increasing?
So we've asked our consultant to look into what's driving the cost of our claims, as well as what's happening regionally and nationally, to have that discussion.
Okay, all right. Well,
They'll be at our next work session.
Yes. Yes. So what you're seeing here is, as you know, we're self-insured. So we attach a cost to each position, and then transfer that to the insurance fund, and then use that money to pay for claims. So roughly, we're looking at roughly $2,000 more per position to contribute to the insurance fund to ensure that we're maintaining a sustainable fund balance there and that we're in a comfortable position if something should happen.
Okay.
Any other questions on personnel? I'll now have Sam Riddle join us for a discussion on air quality. Unless you want to take a break.
It looks like we do need a break. We will come back at 10:20. We are in recess.
Okay.
out of recess and welcoming Sam to talk about air quality.
Morning, Madam Chair, Commissioners, good to see you again. So thinking about the FY27 budget, one of the early things that came to light, particularly concerning federal funding questions, was the local air quality program. While many counties rely on the state-managed Division of Air Quality at the Department of Environmental Quality, Mecklenburg, Forsyth, and ourselves have locally administered air quality programs. Now, when we talk about the Asheville-Buncombe Air Quality Agency, we're talking about air monitoring, obviously, but more than that, the open burning hotline, facility permitting like gas stations for stage 1 vapor recovery compliance, and demolition and asbestos removal. And when we think about what we receive compared to relying solely on the statewide air quality division, we're talking about local code enforcement support, enhanced local monitoring, and community impact, like what you see on the left-hand column there, and the distribution of radon kits, the Sustainable Brewery Initiative, work with our education partners, so on. The reason we're bringing this as part of the FY27 budget discussions is the financial outlook for our independent air quality unit. Essentially, the agency relies on federal funding and fees they collect based on emissions to administer their operation. Over time, their staff and funds have decreased as federal funding remained flat, and fee income decreased as more organizations in the area improved their own operations affecting air quality. That outcome for residents has meant cleaner air, but the outcome for the agency has meant depletion of their available fund balance over a number of years. Therefore, we're bringing 3 scenarios that you see here. First, the agency could maintain its current independent status. This would mean, depending on the Air Quality Board's actions, immediate decreases in staffing and services to match available funds, or outright closure. This could mean no direct financial impact on Buncombe County in the short term unless closed. In the longer term, per the existing agency agreement, once the agency closes, retiree post-employment benefits would transfer to the county. Second, the agency could transition to become a division of Buncombe County. Up until this point, the agency has financially been a component unit of Buncombe County, meaning while the commissioners have some degree of power over the agency, as does the Asheville City Council, the agency's operations are largely separate from the work of the commission. This transition to the county would mean continued local programming, opportunities to redeploy or adjust staffing roles to fit the broader permitting or economic and physical development operations of the county, but also an operating budget impact of approximately $350,000, depending on federal funding, fee collections, and any future capital needs or operating needs that they may have. Lastly, the agency could close now, meaning the agency would shut down, losing local programming and compliance, and only the basic duties and not staff associated with the agency's work would move to the State Division of Air Quality. For reference, while some functions are exclusively in Raleigh, there is a regional air quality office in Asheville that handles 18 western counties, of which Buncombe would become 19. As mentioned in the other scenario, retiree post-employment benefits would transfer to the county. Considering those 3, staff are recommending the Asheville-Buncombe Air Quality Agency transition to a division of Buncombe County under the larger Permits and Inspections Department within the Economic and Physical Development function. The timeline for this recommendation fits into the following. Notice has already been provided to the city per the agreement. The Board of Commissioners are currently slated for a June 2nd budget adoption. And the certification, EPA notice, some of those logistics are still underway and being worked out. Tentatively, air quality as a Buncombe County division could be recertified under the new organization in July. Both Agency Director Ashley Featherstone and Assistant County Manager Tim Love are also here to answer any questions you may have specific to the agency. Are there any questions on air quality?
I'd certainly be happy to hear from them. Anything if they want to, but I'll just say that doing so good earlier.
You really were.
Thank you, thank you. As I was saying, as someone who grew up here and understand just how important this organization is and the air quality to our region, I strongly feel that we need to continue to maintain that and work on it. And so having this organization at the local level, I feel is just much more responsive than having it at the state level. So I'm certainly supportive of your recommendation, but if Ashley or Tim wanted to add anything, certainly happy to hear from them as well.
This recommendation come in conjunction with Ashley and the Air Quality Board. So this is not just my recommendation, this is a comprehensive recommendation coming from them as well. So, any other comments? We would bake this into our budget if this is the guidance that the board wants to give us.
So I believe we have consensus unless anyone has changed their minds. I just want to echo Commissioner Wells and her comments. And it also aligns with our commitment to environmental stewardship, and having that component still a part of us, I think, continues to solidify our support of the environment here locally.
Thank you.
Thank you.
Additionally, we'll take a minute to discuss another major county operation, one outside the general fund, as John mentioned before, our Solid Waste Enterprise Fund. Overall, the decline you see here is almost entirely that we paid for a compactor in FY26 with debt financed revenues we received in FY25. We won't be purchasing another, so that decrease that you see there is that 1.8 million. Salaries and benefits are increasing given the COLA and benefit discussion you heard a moment ago. I will give one caveat here, that is that we're still working out some solid waste expenses, particularly around a potential grant opportunity, and we'll discuss solid waste disposal fees at the next work session, along with other revenues. Any questions on solid waste?
Thank you, sir. Now we're going to move to vehicles and capital projects. I'm going to invite Jake Cloak to join us.
As Jake is getting ready to get started, you heard some of this when we talked about our capital plan at our last work session, but I thought it was important enough for us to understand how we would start moving to our vehicle replacement plan as it impacts so many departments, especially our public safety folks. So Jake, if you would just share with them how we got to where we are and what we're planning on doing going forward. Thanks.
Good morning. Again, Jake Cloak, Fleet Manager. Just wanted to talk about our fleet. As we all know, county employees rely on their vehicles each and every day to perform their jobs, to provide these core functions that they do to serve our county residents. We have a replacement plan that was developed using industry-informed age and mileage thresholds, by function and by vehicle class, with the goal of having safe and reliable transportation with the lowest total cost of ownership. Vehicle classes align with vehicle types and or function. For example, a midsize SUV that is used for emergency response has an estimated lifespan of 7 years, whereas that same vehicle, if assigned to general government, has a lifespan of 10 years, So you'll see on this slide, year one, beyond lifespan by class and above 150,000 miles, 51 vehicles are identified. So for FY27, we have identified 51 vehicles for replacement. So this is a phased approach. So for year two, we are projecting 49 vehicles. Years 3 through 7, year two, we're dropping down to 135,000 miles. And again, this is based on industry informed. We have benchmarked the mileage thresholds. Forgive me, excuse me.
We're not going anywhere.
So again, the vehicle classes, they align with the vehicle types and or the function. So again, those emergency response vehicles, they have an estimated lifespan of 7 years, where those general government vehicles have a lifespan of 10 years. So that's where you see those differences. So the general government vehicles, those have a slightly, we're able to use those a little bit longer. Those emergency vehicles, they're used in a more severe duty capacity. They're idling more, they're more used in a more extreme duty. Again, a phased approach. So year one, beyond lifespan and 150,000 miles. So we've arrived at 51 vehicles. Year two, beyond lifespan and 135,000 miles at 49 vehicles. Years 3 through 7, beyond lifespan, 135,000 miles for general government, and beyond lifespan and 100,000 miles for emergency response vehicles. Forgive me. I'm sorry.
You did a great job.
Thank you.
Yes, you did. I do have a quick question. So does this include the emergency management?
It does. It does not include ambulances, and you'll see a note on that, and we'll touch on that in the next slide as well. That is the only exception to this, is the ambulances.
Thank you.
So here we look at the specific departments. So the sheriff's office, that is by far the greatest number of identified replacements at 38. By counts within our fleet, they have the largest count within our fleet. They make up the majority of our fleet by numbers. So on the last slide, we identified 51 replacements in next year's budget. You'll see 54 here, and the difference is because of those 3 ambulances, and that's the difference. So those 3 ambulances are added to that total of 51 to make 54 here. So the departments represented: the sheriff's office, emergency services, permits and inspections, general services, health and human services, and the library, for a total estimated cost of $4.2 million. That is all inclusive of all the costs involved in getting these vehicles on the road.
Talking about the remounts at all.
We are doing 3 remounts. Do you want to talk about the remounts?
I'm sorry,
Do you want to talk about the remounts?
what specifically?
Just that we're doing.
We are including 3 remount ambulances included in this. We do have a plan for ambulances, a multi-year replacement plan for ambulances. So for ambulances, we're going to do remounts, which is not a full replacement. So you purchase the chassis and you remount the box of the ambulance. So that's a way to really extend the dollars. The box of the ambulance is able to be reused. The chassis is really what gets the wear and tear. So you purchase a new chassis, repurpose the box of the ambulance, and it's a way to save dollars there.
How many times can you remount the vehicle? Can you do it over and over? Is there a lifetime to that?
To be honest, can I follow up on that? I'd rather Taylor speak to that.
I'm sorry, when I asked you a question, put you on the spot.
It's twice.
Forgive me. Twice.
Any questions for Jake? And I will say,
He
before
has
Jake,
one more slide.
okay. Before Jake moves on, he is our first fleet manager. So he has come and brought a level of professionalism to what we do when it comes to these vehicles. So I do want to give you kudos, and the reason you're here is I want to thank you in public for what you've done so far to get our fleet where it needs to be, so thank you.
Thank you, Ms. Bender.
Thank you for noting that, and this is incredible work for your first year to know that we have a vehicle replacement plan in place. We are really grateful. Thank you.
Thank you. Sorry I stumbled up at the beginning.
Hey, it's okay. You're
Getting back on track
You are
now.
doing great.
So for the last slide I've got, so we have some new vehicles. So each and every year, departments request new vehicles as well. Departments requested new vehicles as part of this year's budget process as well. as part of that process, we have a cross-departmental team that evaluates these new vehicle requests. That cross-departmental team, which is referred to as the vehicle evaluation team, evaluated these requests. That has been whittled down to 19 vehicles that are recommended as to be included as part of the budget at a cost of $762,000. And those are 10 of those 19 are related to new positions, as you'll see on the slide. Those are contingent on those new positions. 9 of the 19 are related to Health and Human Services motor pool, and those are recommended as they will reduce employee reimbursements. They also will increase safety and enhance our sustainability efforts. Those have also been evaluated by our, forgive me, yes, S&I team. So I'd be happy to answer any questions if anyone has any.
I have a question. Why do we lease some and pay some debt or pay go, like what?
Great question. We lease for the motor pool. Those are, due to the motor pool aspect, those are, I guess, those have multiple drivers, and those have, I guess, children in the car and multiple people. So we want those to be very reliable vehicles. They go out of town. They have, I guess, really the aspect of having the multiple drivers and the children in the car. So we want those to be very reliable going out of town.
We started the leasing model just a couple of years ago. Part of the issue for us had been supply chains, so that it was also difficult to purchase vehicles because it took so long to find them. And when we go with a leasing partner, they have a little more accessibility to purchasing and more purchasing power because they're larger organizations. So we started exploring that model. We're still in the phase of evaluating how that's working.
It looks like it's cheaper.
That is the 1-year cost, correct?
That's the 1-year cost for those. So the leasing costs recur, so.
But I think if I'm remembering correctly, staff did run some numbers at the time when we were considering this and felt like that it would be the best fiscal decision as well.
And again, like Jake said, it's the sort of vehicle our permits inspections team is out off-road on dirty sites. That's not the vehicle you want to lease. And again, we started this model and then the storm happened. So we only had a couple of the leases in hand. So we're still evaluating that process now.
Other questions?
Thanks, Jay.
I can't get chastity out of my mind. My grandfather was a mechanic. So I'm wondering, are you welding the box onto the truck, or like, what do you mean whenever you said that?
So the chassis is really like the wheels and the tires and the frame of the vehicle. So the motor, the wheels, tires, frame, the box would be really what transports the patient. So that's going to be bolted to the frame.
Okay.
And then, yeah, the engine, the frame, the wheels and the tires, that's the new portion.
Sometimes you just got to chase the rabbit. Thank you.
Yes, you're welcome. Thanks, everyone.
Thank you, Jake. I appreciate it. We're moving on to debt project requests evaluated by the capital review team. These include the 40 McCormick Place EMS space to renovate the former general services facility into a downtown EMS space. 94 Cox Avenue structural repairs is a project to address structural and moisture intrusion issues at that facility once it is vacant. That is the former tax office down Cox Avenue. A design of a new EOC and storage facility is to design a facility to house some county storage, a county emergency operations center, and offices for emergency services administrative staff. Biltmore Avenue Community Health Center repairs are to fund repairs at the 257, 277, 283 Biltmore Avenue facility that is currently leased to Western North Carolina Community Health Services. Courtroom renovations are to fund a renovation to courtroom 4C at the county courthouse, which is used for juvenile court. Detention center facility controls system upgrade is for the replacement of outdated HVAC controls at the detention center, which is necessary to maintain state standards for heating and cooling of the facility. This project has been planned for several years and the work is now ready to be started. The PAC library elevator upgrades to replace outdated elevator components and to bring the elevator up to performance standards. The EMS West Regional Base construction is to fund the next phase of that project at 359 Brevard Road. The South Buncombe Library renovation and repair project is to perform repair tasks identified in the facility assessment, such as lighting replacement, interior upgrades and renovations, and electrical repairs. The new parks and indoor recreation facility is designed for a potential parks office and indoor recreation facility that may also function as an emergency shelter at the Buncombe County Sports Park. The Swannanoa Library and Government Complex for land and design is to fund land acquisition as well as design for a 20,000 square foot facility in East Buncombe to replace the existing Swannanoa Library, along with providing space for other Buncombe County services. Are there questions about these projects?
I appreciate how you've added the ongoing annual costs to the side there too. That's a really helpful.
Yes, I think it's important, and we note that capital projects come with associated ongoing costs. I mean, if we, when we launch a new EMS space, sometimes that will come with new trucks and new staff. So those are ongoing costs that we have to think about. Sometimes you actually are saving dollars with certain repairs. We'll talk about how this debt load of $38.3 million will impact the county in a moment. The following projects are lower cost projects, which generally do not enhance the value of assets for which we would not want to issue debt. The 40 Cox Avenue Security Enhancements Project is to modify the layout of this HHS facility paired with a detection system in order to provide improved access and security for county staff and clients in the building. 49 Mount Carmel Road renovation repair is to perform repair tasks identified in our facility assessment, such as HVAC upgrades, lighting replacement, and sewer piping repairs. The community center assessment repair project is to perform tasks identified for the Sandy Mush Community Center. The detention center body scanner replacement is to replace the body scanner at the county detention center as it is out of date. The detention center facility assessment project is to replace the kitchen refrigeration system, as the current system requires consistent repairs. This system provides all the refrigeration needs at the facility and provides approximately 40,000 meals a month to inmates and staff. The Glenbridge River Park boat launch replacement is for the construction of an ADA accessible boat launch at the Glenbridge River Park, and design has already been provided at no cost by North Carolina Fish and Wildlife. And the interchange interior conversion project is to convert a portion of the first floor of the interchange building into an IT equipment receiving space in order to receive, stage, and deploy equipment efficiently. So as we discussed earlier, these items would be a $1.8 million transfer from the general fund to pay-go these projects in the capital fund if these requests were approved. Any questions about these items? Okay, this graph should look familiar to you. This represents the cost of capital to the general fund over the next 7 years. And we have been coming back to this graph a few times. As we discussed earlier, this year's debt payment is $18.3 million. In the dark blue, you see the already committed debt payments that we need to make over the next 7 years. And you see that debt load begins to shrink year over year. Newly issued debt was presented by our CFO last week. It includes 2022 general obligation bond projects, as well as some prior year approved capital projects. So that when we move forward with that debt this year, you see the light blue, which will increase this year's debt payment to $30.1 million. Are there questions about this debt, this cost? Adding the projects you saw earlier, in the purple is the addition of PAYGO dollars to support the PAYGO projects we just presented. In the orange, you see vehicle debt related to the vehicles that we presented to you earlier. This is for the recommended replacement new vehicles that we recommend debt for. And the yellow represents how we will see additional debt for the slate of debt projects, the $38.3 million of projects earlier. Now, this is just the next several years. This is not the life of those entire debt projects. Are there questions about the cost of capital based on the recommended capital projects and vehicles for 2027?
Is there a reason why on fiscal year 2027, the pay-go is there, however, 2028 doesn't have it?
So we decide pay-go projects in the given year. So in fiscal year 28, when we receive requests and we evaluate those, and we decide which projects are going to be slated for debt or pay-go, we would bring those in a given year. So what we're showing you today is if the requests that are brought before us today in terms of pay-go capital, vehicles, and the debt projects here, what that happens to the debt load over time. Earlier in January, we showed you other scenarios that included another round of GO bonds and what the cost of capital is for the entire 7-year CIP. But this is really just to show you what the decisions we would make for this year's budget, how this impacts us over the next several years.
Okay, so is the pay-go paid off in this year? And therefore, when,
Pay-go simply means a cash payment, so we
Yes.
pay that outright.
all right,
Yes.
It's
Thank
just
you.
another word for cash.
thank you.
So yes, those items, the pay-go items would be paid for when the work is completed.
Okay, perfect, thank you.
I'd like to comment on what you've done. I think, we sometimes complain about how expensive things are and where we are. But when you look at our debt versus the size of the county and what we're spending and what we need to spend, it's great. We're doing a good job of managing it when you look out over the 33. And I hope that the public appreciates what the staff is really doing here and the commissioners and what we're approving. Because, it could be a lot worse, and especially when you look at what we've gone through with Helene. And if we hadn't done the work beforehand, where would we be now? So let's not forget that.
Thank you, sir. The following requests for Information Technology Governance Committee have been made. These represent new or replacement software. We have AI for public records and redaction. This is AI-assisted tools to streamline identification, review, and redaction of emails and other records when we receive those requests. 911 has asked for a community feedback platform that allows telecommunicators to receive feedback about their call performance. A county payment processor is a migration of the Forte payment system to Pay It, which finance has decided is a more useful system. It's used by the state for and other counties as well. It's simply our payment processor for credit card payments. Legal and Risk has asked for an enterprise risk management module. This is another module of their existing risk management software, which would include a migration to the Green Book framework for internal controls. General Services has a ticketing system for their work orders, and that is called Facility Dude. It's not been upgraded for some time, so they've asked for an upgrade of that so that they no longer have to use paper work orders. And the field training tracker is for emergency medical services based in-field training, so that instead of EMS training officers carrying around clipboards to decide which paramedics have been trained on this or that, they can actually have a system that catalogs that. So these total projects in first year total $227,000 and are reflected in the earlier IT budget requests that you saw earlier.
I'm
And you just
curious
said
if-
first-
I'm sorry?
I was gonna say, you just said first year?
Well, software has recurring costs.
Okay.
So yes, I do not believe any of these is a one-time cost. So yes, when we adopt new software, there are implementation costs in the first year and then recurring licensing costs year over year.
It'd be helpful, just like you were doing with some of the others where you were showing the ongoing costs. That would be helpful then also with the IT.
Yes, I would like to build this out a little more, and we can do that. Sometimes we don't know what the particular software solution will be. We know that we need to do something and we need a software, but it may take us into the year to decide what that software is and then figure out how much it costs year over year.
I'm curious about the AI for public records and redaction. Is that intended to expedite public records requests and to alleviate some of that from our CAPE team so that they can do
Yes,
other work?
that's the purpose of that
Thank you.
software.
That's the idea.
That's the idea,
Yeah.
yeah.
Then we
'Cause
have
from
to
my
go
understanding,
shop.
it's really cumbersome to do that and to make sure the redactions are there, so knowing there's a way to
A
help
lot of
expedite.
that work is right now being done manually in terms of figuring out what emails are not, and we really need some help because the requests continue to get larger, and we just don't have enough time in the day to review emails, so.
And to make sure that any sensitive information is removed. This is interesting to see.
That's why I said it's the idea, because we still have to put eyes on it. 'Cause
Right.
AI can.
It can make
shrink.
mistakes.
Right, but they can shrink the volume for us, but then the manual part will come in. But right now, it is all manual, so if you ask for email for the last 3 or 4 years, every email must be looked at by Kurt. Quite honestly, it is Kurt that is sitting there looking at every single email. So hopefully, if you ask for that and you give us keywords, we can then shrink that scope, and then he can just look at it
That's really
after that. So,
Great.
so that is the idea. Now we have to go shopping to find a solution.
Right.
Of what it would actually cost.
Any other questions about IT projects? So in summary, you see that these requests comprise a 15% increase over the fiscal year 2026 amended budget. We continue to work through requests, and when we have a revenue discussion in our next work session, we will be able to more clearly speak to those items that can move forward. We would like to talk about guidance for community investments or any other requests reviewed today. To restore these particular investments to prior funding levels or to increase as requested would result in $4 million additional budget. You received some correspondence from our Strategic Partnerships Director, Rachel Sawyer, earlier this month about the number of grant applications received for funding across the wide spectrum of different areas. So in order for the departments that are administering these programs to begin their process on awards, we'll need to understand the recommended funding levels.
So is this a list of all of the community investments that were cut last year?
This is a list of the community investments. The only one up here is not, that's not up here is HCCBG. That's in the, that's in HHS's budget. So this is what was funded in current year versus the request we're receiving to move forward next year.
And does the strategic partnership grants, at one time we had REC grants as well, and did you
Yes, they're
fold in, did you
corporate.
cut, did you just, was the funding for the REC grants now added to the strategic partnership grants, or?
Yes, the rec grants are, the strategic partnership grants are, they widen their focus, so recreation grants are
And did the
included.
funding take both of those buckets?
I believe,
Or is that just, wasn't strategic partnerships just 1 million?
it was about
That's a great question.
$900,000 and change, so.
Okay.
And there, in the email that she sent, there's specific detail on each of the grant funding.
That's a great question. I believe the strategic partnership grant was rounded off to $1 million to include that. But I would have to go back. It used to be about 900 and something 100,000, and then that was 100,000 by itself. So I think we rounded it off, but we can make sure that it's inclusive and gives you the appropriate number.
Thank you.
And then with the arts grant, that looks good. I think that increases it up to that per capita. Because I know when we started it at one time, we based it on the per capita, and then obviously the population has grown, and it hadn't been being adjusted each year, but it looks like you've got it to where now that's.
And so if you recall at our last meeting, the comment was made that we want to refit this to what we used to do and any of those increases. So that is what this is. You have the option to say we keep it at the 130, or we can go ahead and give it the extra 12, which is the 50 cent per capita. Same thing with early childhood. Early childhood had a built-in 2% escalator. I would say that I would love to have a conversation with early childhood, because there is some funds that's been left over from last year that wasn't spent. If we can reprogram that instead of growing it by that 0.1 thousand, that would help as we start to balance our budget, because Martin and Al, I forget who else is on that, and Jennifer, on that early childhood, you only spent, let's say 4 million was the number, you spent 3.8, so you have 200,000 left over that was not allocated this year. And I would say instead of growing it to the 4.1, you put that 200 back in play, and instead of growing it by that percent, and you still have your 400.1, but it would not be all new money. You would use the 200,000 that's been left over from current year as a carry forward.
Happy to chat, if you don't mind. Just we're right in the middle of the grant process, so all kinds of things to talk about.
Correct. So you still have $4 million, but it won't be new allocation from Buncombe County General Fund. It would be 200 plus 3.8 to get you back to the 4 million.
You mean 4-1, yeah.
That's our fund account.
That's your fund balance.
Yeah, that's
Correct.
That's our fund balance.
Yeah. So go ahead and utilize your fund balance is what I would say.
Yeah.
As we balance that budget, but we can absolutely talk to the committee. And
I can't believe you said that out loud.
use your fund
Go ahead and
balance.
utilize, right?
Utilize the fund balance. Never mind. You give me PTSD.
So utilize your fund balance as a set aside. It is not your general fund.
No,
fund
I know.
balance, but
I'm
you have this set aside pot of money, and I'm not sure why we would sit and grow that versus redeploy it.
Ideally, fund balance would live in the general.
Yes, not in all these
I
separate.
look forward to our
funds.
next meeting with schools.
Yes.
Explain something to me. Education support. Maybe I slept that. What is that? And why isn't it in education?
So that's a series of contracts as well as the special projects. There's $80,000 of special projects that we give the schools for smaller projects that don't meet the definition of capital or don't get to the table for their school capital commission. That was started several years ago by the commission. That also includes the Irwin Career Academy and the CALA program, which is a collaboration with City of
That's been around
Asheville.
for years, yeah.
And so those are the items that are sitting in education support now.
The 25,000 is,
$25,000 additional is a request to fund Asheville Museum of Science directly,
to restore that.
which fell off over the last couple of years.
We had been funding it, but it ended up getting cut this year.
Yeah, we cut it during the, when we did the Helene reductions, so it has not been funded for the last 2 years.
Correct.
Oh, because
It wasn't
oh.
drawn down. They did not draw down the revenue in the last year that we
We did,
funded it.
yeah.
So it was a cut that we put in place because of Helene reductions.
Okay.
And because it hadn't been utilized.
Correct. Since it wasn't utilized, we cut it. So when in our last meeting, when we talked about, maybe it's in our retreat, when we talked about starting back from what we used to fund, that is why we're here today. So that 9.1 is now in the budget, but it represents 4 million above what was there before. So we just, as we start to go to the committees to fund affordable housing, all the applications that came in for that, the applications that came in for early childhood, and the requests from education support and the Arts Council, we want to make sure we understand how much money we have to then give that committee guidance where they can start. So looking for some feedback from you guys to see if you 100% the 4.4 million is in, or if you want to have some conversations with me so we can then give guidance to staff and the committees.
Conversations with you?
I think conversations seem to be the consensus.
I'm sorry, what was the question?
Conversations seem to be the consensus about what to,
Where we
Where
would
we
land. You don't
land.
have to decide today, but I would love within the next week to get guidance so we can then in turn, I give guidance to staff and the committee of how much money they have to allocate to the grants that did come in.
my colleagues on affordable housing are not able to join us today, but I'm going to tell you all, as you saw last Tuesday, we have had a significant amount of applications, and a lot of organizations have spent a lot of time putting their grant proposals together for us. And at this point, I will say to you all, I'm going to advocate that for now we do keep that 2.3, because we also have the decision as to what to do with the Cox Avenue. And could potentially be, if we allocate all of that to Cox, that all of those organizations that have worked really hard on their proposals without this could potentially not receive funding.
Yeah,
And I know how much work goes into those grant proposals, and that's asking a lot of people to do a lot of work for potentially no return on that.
yeah, I mean, I feel like these were community investments that we'd been making. I mean, I understand that we had to make hard decisions with Helene, but I am supportive of us having this back in the budget because we made those hard decisions in. But I think this is important funding.
Thank you, Commissioner Wells. Any other thoughts or comments at the moment?
And Commissioner, you're on all of them, right?
Yes.
To keep it in there. Thank you. So we don't have to have a conversation later. Thank you for that. I appreciate that.
And thanks to our early childhood folks for willingness to have the conversation about that remaining balance as well. Not fund balance, the remaining balance, unallocated dollars, let's say that.
That's what I call it, but it is a separate fund that they've set aside, so it is growing a fund balance in that fund that can be redeployed. So 4.1 would be the number, but my question for you is, could we use that fund balance to get to 4.1 and not add a new number? That's the question I will have for you and you all to think about.
That's fair. All right, thanks, commissioners.
So are there any questions, or do we have any other thoughts about requests? Anything that we have strong feelings on?
So before we move on, I've got Terry's, Commissioner Wells, so I would love to hear from you guys where you land on that list. If we can get that decision by next week, that way we can move the committee forward.
Next week, okay.
Yes, sir.
I'm going to make a note to myself, but would you mind sending us an email of that and any other questions that may come up afterwards that you want direct feedback from us on?
Absolutely.
If it's in my inbox, I promise I'll respond.
No worries. Thank you.
And then confirmation is, I'm sorry, Commissioner White.
I'm fine with where we are now.
Okay. You're fine with the first pass?
Right.
Including everything?
I sure am.
Okay.
I'm fine with the first pass, with noted the question about the recreation grants and how much did get rolled into strategic partnerships.
All right, I'll reach out to the rest of you. Thank you. I appreciate that.
So any other thoughts on requests? Anything we're feeling strongly about? Any other points to weigh in on what you've seen?
You know, I have some thoughts on the new positions, which I understand what we're doing. But my thought is from the other side of this. You know, we're in AI now, and it's a new environment. But as we look at the new positions, could we find out what changes we've made with existing positions? Because some we've made to our benefit. A good example of that, we're going to contract out the internal audit procedure. Now, that is, sure, we're paying for the contract, but that's doing away with FTE or potential 3 the way we had it, and would be paying for the benefits and all. Well, it would be good to see how we're balancing all this out. Because, you know, it's not always what we see. We're adding all these positions. But on the other side of that, it could be others it's changing, or some we're doing away with.
We'll take a look at that and get back to you. So I do want to clarify on the internal audit, there's a 3-year contract.
Right.
But the FTE number is still in our plan because intended that contract would come back in-house eventually. So the contract for internal audit, right now it's envisioned that we would get that baseline set and they would help us to build that internal audit department by giving us the risk assessment, giving us the template for our audits, and then hopefully we can bring that back in-house in the long term.
But if it works, wouldn't it be to our advantage to leave it outside?
Almost every that we do, when we take it out, we continue to assess and make sure what is that break-even point. We're looking for that break-even point continuously. One of the positions you see in here was for that in-home aid because we had a contract in years past and we're to the point where that vendor is telling us they can no longer provide it effectively. So now we're looking at bringing it back in-house and we have to stand up a staff, get them trained so we can then take that on. So there is always a break-even point that we're looking at to make sure we make the best decision for our county and for our residents as we move forward. Several of the positions in here, we are trying to look at the volume of work that is coming in, look at some of the state mandates that they have on us, and try to make sure we're meeting the state mandate for the position. So we can take a look and see if there's offsets, but the positions that we have put forward so far, there were no offsets for those positions. I'm not sure if I answered your question, but we would take a look. We will take a look and show you. We had over 100 requests. Some of those we said, no, we're not going to do these. Here's the ones that we are considering because of the workload and because of the offsets. Are there no possible contracted services that we can do to do those positions? But we'll get you a more detailed answer of why in-house versus out-house, outsource.
Okay, on to our next steps. On April 16th, we will have a full agenda with the fiscal year 2027 revenue discussion. We'll have a discussion of healthcare costs and bring in our consultant for more information. We will highlight changes on the fee schedule, which will include our solid waste disposal fees. Additionally, we will hear from Asheville City Schools on their requested supplemental tax rate and AB Tech on their operating budget request. We will not hear from schools on an operating from BCS as we have slated the funding with the funding agreement.
So said another way, BCS and ACS will not present on their local current expense and their operating budget. The only request you would hear from ACS is on the supplemental tax and what that rate, they would request that rate to be. But they would not be presenting on their local current expense or their local budget.
On April 28th, we will have our last work session. We will discuss fire district budgeting. We'll provide a year-end projection for fiscal year 26. We'll discuss budget changes made to that point, have information on community investment grant awards, and HR will present on the classification and compensation plan. The following week, at our regularly scheduled meeting on May 5th, we will recommend a budget with a recommended tax rate or tax rates. And then 2 weeks later, we will hold a public hearing and then move to adopt the budget on June 2nd. Any questions?
Is there anything else that you need us to bring to you at any of our next work sessions? Any questions or comments that you need to make sure we do the research on and bring back to you?
Not other than what we've already suggested.
Other questions come up, send those to Avril and John so we can be prepared for the 16th.
Thank you very much.
Thank you.
All right, thank you. Thank you. Thank you, John, Avril, and all the staff who have worked really hard on getting us to this point. We appreciate it. Before we adjourn our meeting this morning, it has been brought to my attention that we lost a member of our Buncombe County family this morning unexpectedly. And before we adjourn, I would like to take a moment of silence to recognize a lost life on our Buncombe County team. Thank you. All right, without any other discussion, we will adjourn